Okay. Okay. So here is it.
Recording.
I'm ready whenever you're ready, Doctor.
Okay, ready, Doctor.
Okay, so let's say that my name is Robin, and I'm meeting you. I've been referred to you by the GP. 1, 2, 3, go.
Hello, Mr. Robin.
Hello, Doctor.
I'm Dr. Noor, one of the mental health doctors working in the unit here today.
Hello.
I understand that you have some difficulties with regard to illicit drug use. Am I right?
Well, this is a very sensitive issue, Doctor. You know, I feel that it is very difficult to talk about it.
Yes, I understand the difficulties that you have been having because of this issue, and I'm here actually to help you to get out of this problem, if you don't mind.
Okay, no problem.
And Mr. Robin, I also want in the beginning to take your permission because some areas of this conversation may a little look sensitive. So I beg your pardon in anticipation. Is it okay to
No
proceed?
problem. Okay.
So Mr. Robin, can I know what is drug or drugs that you are taking or using right now?
Well, I'm using heroin, Doctor, and I feel that I'm losing control over it.
Heroin, nothing else in the time being.
Mainly heroin now. I don't take anything else.
Okay. And for how long you are using heroin?
Maybe for 10 years now, you know, who counts?
10 years, that's long enough. And can I know exactly the frequency of your daily usage of heroin?
I don't understand. I take it on a daily basis.
Okay, and in a typical day, how much roughly do you take, if you can tell?
I can hardly now keep it on 1 gram per day.
1 gram per day, I see. And as I understand, these street drugs are a little costly. I wonder how do you afford for that?
Well, you know, sometimes I'm indulged in you know selling it and just to make up the amount of money which I need to get to buy these things. I'm not able to work.
I see. It must be very difficult for you. And have you been involved in any like criminal acts in that because you want to afford for the drug?
I'm already dealing in this stuff. I don't think that this is legal.
Okay, I understand. And Mr. Robin, uh, have you ever tried to quit?
I tried several times.
And during this 10 years, Mr. Robin, have uh, sorry, back to your last comment. I would like to know what made you restart or reinstate using it again after quitting.
I know many things in my life, doctor. I feel sometimes that I'm not able to quit. I'm not able to tolerate the withdrawal symptoms. And sometimes I feel that the heroin is my only friend.
What exactly happens to you when you quit, when you skip one or two doses?
I feel horrible, doctor.
Horrible. I see. I see. And is this 1 gram the the initial dose that you started with?
No, I just tried to use it casually, with my friends, but now I'm stuck.
It was like peer pressure. I understand. And
Yeah.
you started, and over time, did you increase the dose in order
Yeah,
to
yeah,
have the
yeah, yeah. I can hardly keep it 1 gram only every day.
1 gram every day? So within these 10 years, now you ended up with using 1 gram per
Yeah,
day.
yeah, yeah. I can
Okay.
hardly keep it like this.
And do you often crave for the drug?
What do you mean by crave?
You have the like the urge that to have the drug as immediate as possible.
Yes, yes, I do.
Okay. And do you think that your life is getting around just on this heroin, or you have some other
No, no, no. It became my priority that I must take heroin.
priority? Yeah, I understand the difficulties that you are having. And Mr. Robin, if I'm allowed to ask, uh, did you have you ever get involved in casual
1 minute
sex
remaining.
when you are intoxicated, or in an attempt to gain money to afford the drug?
Again, what is the question? I didn't understand it.
Mm. Have you ever get involved in any problems when you are intoxicated?
Yeah, yeah, yeah. I was one time I was overdosed. Another time I was caught by the police, but no
I
legal
am
charges were set against me.
okay. And have you ever tried injectable heroin?
Yes, I do inject.
Mm. As this may put you in risk of sexual transmitted diseases, I would like to know whether you have had any blood tests specifically for
No,
HIV and hepatitis.
no, no, no.
Not before.
Time.
And
How do you feel
how?
about what you did? Time. شوي
Mm,
جازول
mm.
خلاص يزول.
Yeah, marhab.
Time
Too much.
يزول.
Too much points are missed. Maybe because of
Okay,
poor
give me
money.
feedback about what you did, and please give him some feedback in the chat section. Your
Mm,
colleagues. Okay, how do you feel about what you did?
Not very good, to be
Why
honest.
is that?
I just because in the beginning I missed to ask about the route of administration, and from there to go smoothly to the risks related to that.
Yeah.
And I think that area of dependence, I tried to cover it to some extent. I think it's good, not bad.
Okay, so let's see the feedback of our colleagues. Well, Amara is giving you is a very good feedback that it was not a very like of a conversation, more than a question checklisty approach. No empathy, slowing down, and many other very important points, which I hope that if you can take a screenshot just to help you to understand how to approach these stations, our colleagues, they are all experienced doctors and they give a very good feedback, definitely. Uh, so he points which you should have covered, okay, and need to be organized, insight and motivation also, yes, that's very good. All these are very good points to be covered. So I'll give you my feedback. In the beginning, the sorry, the empathy is very important in a very important consultation skill. And the best time to show empathy is not all over the station. It's not a psychotherapy session, just in the beginning, in the very first beginning, when you start to open the conversation and hear the dialogue or and hear the complaint of the patient, show empathy, okay? And particularly with these sensitive issues, you must be very, very cautious when you open the conversation about these issues because you were cautious and you took permission after asking about the drug, which I think it has been a misplaced permission. It was too late. You were judgmental. I said I was taking heroin for 10 years. You said 10 years. Don't do this. Too long. You said too long. Don't do this. Um, well, you don't ask about, you started by asking things which are not related to the task, okay? It is nice to know, but try to show that you are very keen to cover the main points or the most important points in the beginning. So you ask about the frequency, the money, the criminal acts, all this before starting to ask about the tolerance, withdrawal, etc. Okay, so the criteria of dependence should come first. I said to you, I'm indulged in drug dealing, and then you ask me, are you indulged in any criminal acts? It would have been better to say, so this is serious, I wrote about you. So anything else which can be risky, which are involved in because of this behavior, you can open or cover the risk when he started the talking about this issue that he is drug dealing. That's how you make it a conversation. I always said that I'm doing drug dealing, so I'm just worried. Have you been involved in any legal problems because of this? What about taking heroin while you are driving? Okay, are you injecting heroin? Because this is also serious. I'm worried about you. Uncover all the risk. When I said you can just, I opened the door to discuss the risk, but I felt that you did not pay attention. Said that I said to you that I'm drug dealing, and you ask me, so are you involved in any illegal problem or risky behavior, as if you didn't hear what I said. Um, when I said that to you, that I feel horrible when I stop taking heroin, the role player will not say to you what are the exact withdrawal symptoms. As far as I know from the colleagues who have been in this station, it is expected from you to ask specifically about the withdrawal symptoms, okay, like, diarrhea, okay, vomiting, nausea, body aches, and so on, impaired sleep. Okay, let's see how can we do it according to my approach and my slides. And again, this is not a must for you. You can cover the task or the mark sheet by any way, but make sure that the mark sheet will be covered according to um, your performance. So let's see. So the first thing which you should pay attention in this station, that substance misuse is a sensitive issue, and take permission before going through the details. And usually the increased intake is associated with life stresses. So you said that it was a very good question. Are you taking this 1 gram all of your life when you started taking heroin? Usually, the course of those who are taking substance, whether it is heroin or non-heroin, it is a stepwise fashion. So most probably there will be a life event in which they needed to increase the dose, and then they are stuck with this dose, and they go on with this dose, and then another life event come, and then you're stuck with a new dose, and eventually they are stuck with a very big dose. So there is a stepwise fashion. It is not a linear thing like this, most probably. So you must ask me, so since when are you taking 1 gram at any particular event? This is a very important question. In alcohol dependence, he has been indulged in a particular job and he used the alcohol to calm himself down, and the dose increased. And in this station, there can be a life event, which I don't remember what quite well. What is it? Okay. As I always say, pay attention to your communication skills. The role players are instructed not to be cooperative with the candidates who are not empathetic. Okay, again, I forgot to share my slides. Sorry, I'm talking with myself. Wait. Okay, so, and this is a schedule by which you can pick up some sentences to help you to do some empathy. Very important to pay attention to your introduction, and you must understand what is the type of patient which you're dealing with and what is the setting. So you are a doctor in the alcohol and substance misuse service. Introduce yourself. I'm Dr. X from the alcohol and substance misuse service. I've gathered from the notes that the GP has referred you to talk with one of our team members. I did not mention anything yet, but just introduce myself and greeted the patient, okay? And either he will start talking about his problem of heroin, or you are going to ask him specifically. I have gathered from the notes that the GP is worried about you because you might have been indulged in substance misuse. I know that this is a sensitive issue. Can I take some information about it? Okay, so whether this or that, pay attention to the way which you start taking the complaint. It's very important to show the examiner that you are professional. History taking is not just about picking the symptomatology of the nosology, the diagnostic criteria. It is a structured approach to come up with a diagnosis. Again, history taking is a structured approach to come up with the final diagnosis. It starts by taking the complaint. So first thing, you want to know the current situation, okay? What is the heroin problem, and how much does he take in a typical day? How does he take it? Does he take any other recreational drugs? So this is the current situation. And then you ask about the onset, since when he started taking the heroin, and how did he start taking it, since when, and then the course, is it increasing and decreasing, and so on. And you want to know before taking heroin whether he has been indulged in any other substance or no. Don't underestimate the stage of taking complaint. It covers very important parts of the history, and at the same time, it shows that you are professional. You know how to start taking history. Every candidate just want to jump into the nosology and try to ask the patient specifically with close-ended questions about the particular symptoms and signs of the different syndromes. But this is not a history-taking task like this. History-taking task is a comprehensive approach. Start by taking the complaint, and then when you take the complaint in this organized way, definitely a syndrome will be crystallized in front of you. Now you can take the symptoms of the syndrome. Okay, so you have tolerance, withdrawal, craving, primacy. So there are many, you can just ask about 4 of them, no problem. Okay, but make sure that when you ask about the withdrawal, you ask about the symptoms of the withdrawal in particular, okay? And then ask about the comorbidity. We have psychological, physical, and social comorbidities. It seems that you are asking too much, but when you use open-ended questions, again, use open-ended questions to make the role player talk. If you use close-ended question, and if you are pinpointing about particular points, you will lose time. So use open-ended questions, okay? Psychological, very important in this station to ask about the memory problems, and the alcohol is very common to also be associated with memory problems and depression. Show the examiner that you know this. I did not write here the memory problems. There's also about the memory problems. And very important also to ask about the blood-borne infections and liver problems. Okay. And very important also to ask him about his social circumstances. No, sorry, I messed up between alcohol and heroin. So in heroin, the memory problems are not very common. In social, whether he is alcohol or he is heroin dependent, definitely you must ask about social circumstances. You have very common, just 3 questions enough. Tell me more about your life circumstances, any stressors, any legal problems, how can you afford your life, and so on. And then the impact, coping, and risk. You have medical risk, social risk, and self-harm and suicide. Very important in all. And this is a typical question, typical set of questions which you are going to use in any substance misuse, whether alcohol, GHB, or with heroin dependence. Finally, personal history and family history, very common to ask about the family history because most probably substance dependence runs in the families. Now, delivering the diagnosis, okay, at the end of the station, it is very sensitive issue to tell someone that he has alcohol or heroin dependence problem, okay? So you can just say to him, thank you, Mr. X, I understand what you are passing through and you find it difficult to stop taking heroin. The good news is that there are many ways by which we can help you to stop and sort out the related problems, okay? So enough to say to him that it is difficult to stop taking heroin. Or you can add one sentence, which one of the consultants said, that you must come up with a clear diagnosis. You can say to him something which we call heroin dependence, okay, or heroin misuse. Okay, so you can find you are passing through difficult time and you find it difficult to stop something which we call heroin dependence or alcohol dependence according to the stage. But you must say it in a sensitive way. Don't just throw it in his face from our discussion, you are a heroin dependent person. It doesn't go like this, okay? And at the end of the station, if you have time to ask about the motivation, you can ask. But this is not the main task. Except if you have been asked in the task to check the motivation. So you can check the motivation at the end of the station. Okay, how do you feel about joining or talking with one of our team members who are involved, who can help you to stop taking heroin? Okay, if he says yes, it's good. If he says no, ask him about what the reason, and then ask him use one of the motivational interviewing techniques, which is called developing discrepancy. You have mentioned a lot of problems because of heroin intake, and at the same point time you refuse the help. Where does this leave you? This is a motivational interviewing technique, okay, which I used it before in the GHB station, and I passed the station. Let's see the mark sheet, and actually, whatever the source you are using, doctors, whatever your source, make sure that it comes down to this mark sheet, and that you are going to score for yourself all the points in this mark sheet. Okay, so whether you are using my source, or you are taking a personal tutoring with anyone, make sure that your performance will help you to score in this mark sheet. So number one, does not identify issues and priorities. Unfortunately, doctor, you did not start by asking the important points related to the abstinence. You ask about the frequency, you ask about things which, how much money does he spends. This is not the priorities. You did identify the aspects of the history, explore enough. You did symptoms of the symptoms which will help you to diagnose the dependence. You did cover this, so point 2 and 3 will be scored for you. Unfortunately, the risk is not covered properly. Does not pay sufficient attention to the patient's health view. So in this station, at the end of the station, I think if you gave the patient this, not at the end, it is by the way you talk with the patient, actually. I felt that you are very formal. So if you are very formal, most probably you will lose point number 5 and also point number 8 in the communication. Does not identify appropriate psychological or social information. Definitely, we did not cover any psychological or social information. So some, but not that enough. It was disorganized. As I said, it was very formalic and checklisty. Definitely, your attitude and behavior was good. Sometimes the anxiety makes the candidates do things which are not that wise. So point number 9 might not be a score for them. You did not interrupt me, so you have good listening skills. Unfortunately, point number 9, your questioning styles was not good. And the language, most probably, if your question style is not good, also point number 12 will not be scored for you. So very important, doctors, to pay attention to this mark sheet. It's all about this mark sheet. Let's see the feedback. Faction concerns. Okay, yes, doctor. Yes, the concerns of the GP about the infections. Okay, so who would like to go next? Thank you, doctor. I hope that you found it.
Thank you, Doctor.
Okay,
That's
salam.
helpful. Thank you.
Okay, so who would like to go next?
I would like to go next, sir.
What is your station, doctor?
It's autism.
Autism. Okay. I will share the screen with you. Just give me time. I'm not good with this stuff, man. I'm not good. Okay, see.
I'm ready.
Ready? Very clever.
Yes, sir.
It's very fast. Mashallah. Okay, doctor, let me start my timer. Okay, this 1, 2, 3, go.
Hello, Mrs. Yang. I'm Dr. Sneha. I'm
Hello.
one of the doctors working in the mental health unit.
Hello, doctor.
So from the referral notes from your GP, I understand that you are concerned a little bit about your 4-year-old son, Jonathan. Is that right?
Yes, doctor. We thought that he has a problem in hearing, but the doctor said that we must talk with you. The GP said it has nothing to do with hearing, and I'm here to discuss this with you.
Okay, I can see that you're very much worried about your son, Mrs. Yang. So can I ask you a few questions about his birth and development?
Yeah, no problem.
So, Mrs. Young, when did you first notice that Jonathan has some problems?
Well, when he started to grow up, it seemed that he's different from the other children. The way he is playing, the way if he talks ever, he is not talking. When we call him, he doesn't respond.
I see.
We thought that he might not have, he's not hearing. That's why we asked for some sort of a hearing aid for him to help him.
Mhm. So I see that Jonathan does not respond when you call him by his name.
Yeah.
And what about how does he express his needs?
Well, he doesn't. We know when to feed him. We know when I change for him the diapers. He doesn't express
Mhm.
anything, actually. He doesn't talk. He utters sounds sometimes. That's it.
Okay. Does he speak some words, or is he able to form some
No,
sentences?
no, unfortunately, only words, particularly if he is tense or annoyed, he just shouts and repeats some voices. That's it.
All right, Mrs. Yang. And does he tend to, like, have you noticed him repeating after you any words or phrases?
No, no, no. Only just sometimes he repeats his own voices. Sometimes alone, he just keep uttering particular voice several times.
Okay. Okay, I see. So how about his eye contact, Mrs. Yang? Does he
He
maintain eye
doesn't have.
contact with you?
He doesn't. He doesn't.
Okay. Does
I
he
hold
smile
him
at
in my
you?
in my hand face to face. He doesn't even
Mhm.
look at me.
Okay. Does he indicate his his needs like by pointing at the things around in the
No,
room?
no, no, no.
Okay, okay, I see. And what about his interaction with other children? Is he interested in that?
When he is with other children, he doesn't play with them. He is involved in the toys and not
Mhm.
playing with the toys. He's just involved in the particular parts of the toys, particularly, if it is a car, he keeps spinning the wheels. So he's not playing with the
Okay.
toy as it is, just focusing on
Mhm.
parts of the toys.
Does he like to share his toys with the other children?
No, 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 no. He's
Okay.
just alone most of the time.
What about does he engage in some pretend play like feeding the dolls
No, no,
or
no,
like
no,
talking on a phone?
no,
All
no.
right, Miss Sien. Okay. So how about his daily routine? Does he tend to easily adapt to any changes,
No, not
or
at
does
all. If
he?
he changed anything in his room, the place of anything, he keeps shouting and crying. Once we changed the place of the bed, he was so annoyed. We were very, very, very tense when we did this.
Okay, I see, Mrs. Yang. That's very concerning. And how about does he engage in any repetitive behaviors like clapping his hands
Yeah, yeah,
or
he keeps clapping
jumping when
his
he's
hand. Yes, yes,
excited?
exactly, exactly.
Okay, okay, Ms. Yang. And can I ask you a little about your pregnancy, Mrs. Yang? How was it?
Okay.
How were you
Oh,
doing
I didn't have
during your
any problem,
pregnancy?
and I didn't have any problem in his pregnancy at all.
How about during your delivery, when you were
No,
delivering
no
Jonathan
problem.
or after he was born?
No, no problem.
Okay, okay, Mrs. Yang. Can I ask you about, how was his development, Jonathan's development? Did he have any
Everything was
delays in
okay
his
except,
milestone?
well, everything is okay except that he didn't talk. That's it. He started to talk at the time. Everything was okay except that he did not talk.
Okay, this question I'm asking you now can be a little sensitive, but it is a part of our assessment, Mrs. Yang.
Okay.
Did you, by any chance, use any drugs during your pregnancy
No,
or alcohol
no,
smoking?
no. I'm religious.
Okay,
I don't use this.
okay, okay, Mrs. Yang. And does anyone else in your family or your partner's family tend to have similar condition like Jonathan?
Yeah, yeah, yeah. His cousin is having a similar typical actually behavior.
All right, all right. And does Jonathan has any other medical problems or any other condition that is undergoing treatment,
Like what?
like seizures in the
No, no,
past or
no,
currently?
no, no,
Okay, okay. So, does he? Do you feel that he's always on the go? Like he's
no,
very
no,
hyperactive.
no,
He's not able
no,
to sit in one place.
no,
Okay.
no.
Have you ever noticed, Mrs. Yang, that he's
1 minute
responding to
remaining. No, no,
unseen stimuli around him?
no, no,
Okay,
no.
okay, Mrs. Johnson. And what about his sleep? Does he sleep well?
Yes, he sleeps well, no problem.
Okay. How about his mood? Is he irritable most of the times?
No, no, whenever things changed around him, only like this, nothing else.
Okay, Mrs. Yang. Have you noticed Jonathan? Like, I'm really worried about him. Have you ever noticed him engaging in any behaviors that might hurt himself or others?
Yeah, yeah. Whenever he is so stressed, he hits his head in the in the wall. Yes.
All right, all right. I can see that this is a very difficult situation for you, Mrs. Yang. How are you coping with all this?
Well, I find it very difficult to take care of him. I'm very worried.
All right. Would you like some carers assessment, Miss Yang?
Time. Why do you ask about care? Well, you were so perfect. Just say to him, it seems that Jonathan is suffering from autism. You did
Okay.
everything good. Why at the end you ask about career assessment? It has nothing to do with your job. It has nothing to do with the task. You did it
All
was so crisp, very good. Except at the end, instead of asking, delivering the diagnosis, you asked her about the career assessment. Why did you do this?
okay. I'm so sorry.
It was so good, so perfect. I cannot say that I don't have any feedback to give to you except that at the end, instead of delivering the diagnosis, you said the career assessment. Why is that? Why is that? No
Oh,
need to say that. You can
okay.
show I understand that you are passing through a difficult time and definitely will
All
help
right.
you. From our discussion, it seemed that Jonathan is suffering from autism. Just say anything on show empathy and what deliver the diagnosis at the end. Or at
All
least
right.
say a sentence which show that you are about to deliver the diagnosis, but you went in a
Okay.
totally different
Care of, yeah.
direction.
I was
But it
coming to
was
it
so
after this.
good.
Yeah.
It was
Thank you.
so good. I
Thank you.
don't think that you did any mistake, actually.
Thank you.
There's no feedback. Even our colleagues, everyone is fascinated by your performance. Very good. MashaAllah, MashaAllah. So let's see the okay, so as I say, always pay attention to the communication skills and the consultation skills. It is not an oral exam. So you must show empathy and you must be organized. And again, history taking is a constructive or constructed approach to help you to come up with a diagnosis, not just checking the symptomatology of the nosology. It's not like this. So you introduce yourself in a very good way, and then you ask about the complaint, current situation, and then when did the problem start. You should have asked, is it increasing or decreasing? Show that you know how to stop the station asking about the complaint. Is it increasing, decreasing, stationary? How was he doing before that? So it seemed that definitely all these questions will be answered that it has been going on all over the time. So you covered all the symptomatology, very good, of the syndrome of the autism, which many of the candidates find it difficult to be covered. But you covered all of them, the verbal, the non-verbal, how does he play, his behavior, all of them, and the developmental history, the comorbidity, you ask about them, and very cleverly ask about the risk. Unfortunately, many of the candidates think that autism it is not a risky disorder. It is very risky. These children, they are stressed. They have emotions. The problem is that they do not express their emotions or verbally or non-verbally. So sometimes when they are so stressed, they bang their heads. So it is a very difficult problem if it is present. And actually, this child have this problem. Very nice to ask her how does the family is coping and how they are taking care of him. That's it. Don't go through uh, offering your services. Okay. Past history and
Yes,
family
yes.
history, very good that you ask about the family history because it is common to have a family member with autism and then at the end deliver the diagnosis. It was so good. You covered everything except at the end you delivered. Very good, mashallah. I don't think that I will not do it better than you.
Thank you so
Your
much.
priorities, you did everything in the history taking, everything was good, and your communication was good, everything. And if I were the examiner, I will give you full mark because it seems that just if you needed only 5 seconds more, that's it. You covered everything in the task, your communication, and pay attention. I would like just to highlight a very important point here. You only have
Yes.
7 minutes, only
Yeah.
7 minutes. So you must have a very good time management. Whenever you hear the bell of 6 minutes, which you did, okay, immediately start covering the point number 5, 6, and 7, which are the impact, coping, and risk, family history, and past history, and delivering the diagnosis. You can hardly cover these important 3 points in history in only 1 minute. Okay, so you
Sure,
must
sure.
have a very good time management in task history taking task, and the bell of 6 minutes will help you to know where are you
Sure, sir.
standing in your plan when you are approaching. Okay.
Sure, sir. Thank you.
Everything was good. I don't have any comment. MashaAllah. MashaAllah. Okay. Thank you so much,
Thank
Doc.
you.
Very
Thank you.
clear. Who would like to go next?
Can I go next? I am the alcohol one.
Okay. Alcohol dependence.
Thank
Okay,
you for
let's
this.
see. GHB dependence. Where is the alcohol dependence? Yeah. Here it is. Okay.
Okay, I can.
Okay. 1, 2, 3. Okay.
Hello, Mr. Hussam. I'm
Hello.
Dr. Sonam, the doctor working in the mental health unit. I understand from the GP's memo that you are having some difficult time. Could you please share a bit more about your concern?
Yeah, doctor. I feel so low in my mood, and I'm not interested in anything. And I just want to know more what's going on in my life. I discussed this with my GP. He said that I must talk with you.
Okay, it sounds like you are having quite difficult time. And you mentioned you are having some low mood. How long is it going on?
I think for the past 2 months. I think all my life is upside down.
Okay. And it sounds like for the past 2 months you're having a little bit more difficult. And then do you have any other concern apart from your low mood? How are your
Sometimes I feel that life is not worth living with all this mess in my life.
Okay. And then is there any recent stressor that made you more low and having this kind of like distressing thoughts of life not worth living?
I'm about to end my life with my wife. So it's just my marital life is about to end. So it is now in the court, and
Okay.
it's not the court, issue is not in my favor.
Okay.
So I feel so stressed.
Okay. I'm sorry to hear about your relationship. And are you having any thoughts of harming yourself or life what you're living as of now?
Yeah, it comes to me sometimes, these thoughts, that I don't feel that
Okay.
I'm not able to carry on.
Okay. And then how are you coping with all this stress and the low moods? Yeah.
This is the problem. The only thing which calms me down is to drink alcohol.
Okay. For how long are you? I mean, may I ask you a bit more about the alcohol?
Yes, no problem.
Okay. So how long are you taking? When did you start taking alcohol?
I've been taking alcohol for not less than 25 years.
Oh, that's quite long. Okay, okay. So did that change in the recent past or yeah?
Yeah, because of the problems with my wife. The alcohol was the reason of the problems with my wife, but when we went to the court 2 months ago, it is now more. I'm drinking now maybe every day, bottle and a half. I used to drink between half a bottle to one bottle now, bottle and a half.
Okay. So for how long are you drinking? I mean, around like 1 to 1.5 bottles you mentioned. How long?
2 months ago.
Okay, okay. So it sounds like you started drinking a little more over the past 2 months to cope
Yeah.
up with this stress. And when you drink alcohol, what are the effects of the alcohol that the reason for taking alcohol? How does it help with your
It
stress?
just calms me down, just it. But when
Okay,
I'm yeah, when I'm sober, I feel that everything is upside down more.
okay, okay. Can you just take me through the typical day of drinking over the last 2 months period?
Well, the first thing, I drink alcohol in the morning just to, stabilize the shakes in my
Okay,
hands. Um, and then I just drink some amount with the breakfast, some amount with the lunch. But most
okay,
of the amount is at night to help me to sleep. I stay alone in my room and I drink. That's it.
okay. And you did mention that when you wake up in the morning, you have to take some drinks, otherwise you have the shaking and
Yeah,
all this comfort. Okay, okay.
yeah.
Uh, did you miss any alcohol over the last 2 months period? Did you miss any
Yeah,
day?
I tried sometimes to stop. And one time I needed to go to Hong Kong. It was a very long travel, and I did not drink, and I felt horrible.
And then you did mention you felt horrible and then having this some physical symptoms. Have you ever had any kind of fits, like losing
No,
consciousness, heavy jerking movement of body? Okay, so like over the last 2 months period, did you start taking a little more alcohol to have the same effect like a past over this 2 months period?
again, what is the question?
Uh, Over the last 2 months period, did you have to take an increased amount of alcohol to have that
Yeah,
same
yeah, yeah.
calming?
I did not used to drink this amount. I used to drink one bottle of a day. Now it's one bottle. And I feel that I'm losing control.
And okay, okay, sounds like you think you're losing control. So it sounds like it's a bit difficult for you to control your drinking. Am I right?
Yeah.
Okay, okay. And did you ever seek any kind of I mean, and you did mention about this is affecting your relationship with the wife. How is it affecting your other parts of life, for example, like occupation or like other?
Well,
Yeah.
I'm about to leave my job because sometimes I go under the influence of the drug of alcohol to the job, and sometimes they comment on my smell. Sometimes
Mhm.
I cannot continue the job, staying at work because I need to drink. I have a lot of problems. I think that I'm about to be terminated. 1 minute.
Okay, I'm sorry to hear about a lot of problems that you're going through. And apart from all these things, do you have any kind of unusual experience, like hearing voices when there's no one around,
No, no,
things that are not there? Okay. And how is your
no.
memory? How is your memory?
I feel that I'm a bit forgetful more than before. Yes.
Okay. Did you ever involve in any kind of problem with the law or a police, like drunken
No,
driving? Any?
no, no, no.
And how is it your physical health? Yeah.
Well,
Is there?
I don't know. The GP said that I must do some blood tests. I don't know.
Okay, and then is there any family member who has any kind of addiction or a psychiatric mental health issue?
Yes, my father was an alcoholic. Yes.
And you did mention you're a bit concerned about your alcohol, and then you want to seek the help to help with your mood and alcohol
Time.
stopping. Am I right? Okay,
Time.
thank you
How do you
very much.
feel about what time? How do you feel about what you did? It is
I
very
was.
stressful. I felt that you were using very lengthy sentences.
Oh,
So this
yeah,
is
yeah.
very important to pay attention. So how do you feel about what you did?
I am not very used to practicing, so it's a bit stressful for me.
Is
And
the
I
first
did.
time for you to practice ever? Okay, so for a first time, definitely is something. I hope that you give him some feedback, give our colleague some feedback. So first of all, I want you to show empathy when I said to you that
Oh,
sometimes I feel that life is not worth living.
yeah.
This is a very important thing. So suppose that one of your friends is saying to you that life is not worth living, just you should show empathy. So this is very concerning. I'm sorry to hear this. Can you tell me more about this? Do you feel
Yeah.
ever, have you ever felt that you are submissive to these thoughts and you are taking actions according to these thoughts? I did not feel that you did pay attention to this enough. Um, the withdrawal symptoms, again, when I mentioned those, you are expected to ask in specific what are the problems which you have or what the physical symptoms which you have. Again, when you hear the bell of 5 minutes, you must have a very good time management immediately. Cover the impact, coping, and risk, past history, family history, and finally deliver the diagnosis. Whatever you did before hearing the bell of 6 minutes, you did. Okay, you must try to correct it if you did any mistake. And even if you were going fine, if you reach the bell of 6 minutes, you need to cover for the most very important to cover the impact, coping, risk, particularly in this station, and then the family history, past history, and finally delivering the diagnosis. You can hardly cover these 3 points in 1 minute. Okay.
Okay, okay, thank you very much.
Well, we did not finish.
I
Where are
okay,
you
okay.
going? Where are you going? Don't go.
I'm still here, yeah.
Okay, so let's see how can we do this according to this is my notes. So if you feel comfortable with any other source, no problem, but make sure that you cover the points in the mark sheet. Enough points will be marked for you in order to make sure that you will pass. Okay. Very important to mention that it is a sensitive issue. They expect from you to show that you are a very sensitive practitioner, particularly with alcohol problem, which is a very common problem. Okay, the first thing is to take a complaint, which is something which I consider the most important part in the history-taking task. How to take a complaint? First thing you want to know, what is the current situation? Can you tell me how much do you drink in a typical day? Does this amount increase in the weekends or the parties? Since when are you taking this amount? Anything happen at this time? Okay, do you take any other recreation drugs? Okay, and then you want to know about the onset of alcohol problem. When did you start taking alcohol? Anything participated this like peer influence or stressors? Then course and the duration, what makes it increase, what makes it decrease. And you want to know very important things. Before taking alcohol, was he indulged in taking any other recreational drugs? This is how we take the complaint in the beginning, the current situation, the onset, course, and duration, and before the onset. And why before the onset? And pay attention, doctors, to this information. Why before the onset is important. Now, the Rice College is very keen to pass the candidates who are oriented with the predisposing, precipitating, and perpetuating factors. And I think you did notice this in the stations, the new stations, and the tasks which are required. So why, before the onset, you want to know the predisposing factors, whether he has been indulged before in this issue or anything else, or has been in any problems which led uh, to this alcohol problem. So show the examiner that you know that definitely there can be some predisposing factors which led to this. Okay. Now the symptoms of the syndrome. Don't ask about the cage. One of our consultants said this in the cask. No need to ask about the case, okay? Because it is not a ICD-10 criterion. Are you with me, doctors? So they are keen to that just make sure that you ask about the ICD-10 criteria. Don't need to ask about the cage. And actually, the cage is primarily set to be used in the ER, not in the setting of the OPD. Okay, you need to ask the tolerance, withdrawal, the craving. Did you ask me about the craving?
Not exactly. No.
Okay, so you have tolerance, withdrawal, craving, loss of control, primacy, and there is a rapid reinstatement. You will find in alcohol in particular, there is a particular symptomatology called rapid reinstatement, which means that when you stop taking alcohol, the patient who is alcohol dependent, when he stops taking alcohol for a time, he returns back. If he returns to take alcohol, he returns back rapidly to the same amount which he used to take before stopping. Okay, so this is called rapid reinstatement. Which I think you covered the symptomatology of, but comorbidity, I did not feel that you asked about the comorbidity, particularly that in the in this, it is a 1 month of low mood, so this patient might be depressed. So I did not feel that you asked enough about the symptoms of the depression, the comorbidity. Good that you ask about the memory problems and you ask about social issues. I think you ask about the impact, coping, and risk, but you should ask in details if he is driving under the influence, car accidents, police charges, and if he has any the thoughts of self-harm or life is not worth living. Checking this particular point is important because in the history it is said that he has fleeting thoughts of self-harm, fleeting suicidal ideations, okay? So you should check this particular point in details. And at the end, you should deliver the diagnosis smoothly. Thank you, Mr. X. Don't say it, oh, well, thank you. You have alcohol problem, you have alcohol. It's not like this. From our discussion, it seems that you have been through a lot of difficulties because of the alcohol intake, and you find it difficult to stop, something which we call alcohol dependence, okay? And in addition, you can say that there is depression according to your assessment. If when you talk with the patient, ask when you check the presence of depression, if he has depression, you should mention it at the end. Pay attention to this, doctors, because many of the clients forget this. Okay, the patient is already presented to you with low mood, so they expect from you at the end when you deliver the diagnosis, you must mention that he has depression, if he has depression, and then check the motivation. How do you feel about talking with one of our team members who is specialized in helping people with alcohol? That's it. Okay, this station is very important, and the mistakes in this particular station, as far as I know, is not, they don't forgive it easily because they expect from you to be very good in this type of problems because it is a very important problem in the culture there. Okay. Okay, let's see the feedback of our colleagues. I'm good at him, but sometimes repeat the same. Yes, he needs to make his questions and phrases of questions better. A good attempt needed to explore with the role center exactly. Yes, pay attention to the feedback of our colleagues. Yeah. Thank you so much, Doctor. Very clever. For the first time, definitely, this is very clever, honestly.
Thank
honestly,
you.
very good. Okay, who would like to go next?
Can I go next?
Yeah, sure.
ADHD.
ADHD. Okay, so let's see.
Yeah. We can start.
Ready?
Yeah.
Okay, very clever. One, two, three, go.
Can we start?
Let's say that I'm Mrs. My name is Mrs. White, and the child's name is Robin. One, two, three, go.
Okay.
You can start, please.
Okay. Hello, Mrs. White. My name is Dr. Leong. I'm one of the psychiatrists here. I understand that you have some concern regarding your child named Robin. Is that right?
Yeah. The school said that he must be seen by a psychiatrist, otherwise he will be kicked out of the school. And that's
Right.
why I'm here to talk with you.
Right. Could you please tell me about what's happening in the school?
Well, the teachers say that he is hyperactive and he does not sit still and he's not paying attention. He's disrupting the school, the classroom. And this has been going on for a long time. They cannot control him. And they said that I must seek some sort of help. Otherwise, he
Right.
cannot continue the school.
Right. It must be distressing for you to have managed his behavior. I just wonder, Robin is now 5 years old, and how long have you started to notice all this?
He is an active child. He has been like this for a long time, but it seems that the schools say that this is too much. Definitely, there is something wrong.
Right. Apart from school, do you notice what was his behavior like at home?
Well, at home he is very active, but we feel that this is part of his personality. He's an active child, energetic.
Okay. But are you the main caretaker of Robin?
Me and my husband.
Right. So you has been the school and you has been saying that he's active and hyperactive. Can you tell me more example? What do you mean by that?
Well, at home or in the school?
Sorry?
At home or school?
Both in the school. What was the
Well,
complaint by the teacher?
the school say that he is always moving during the class. He doesn't sit still. And
Right.
when he instructed to sit, he doesn't sit more than 1 minute and continues moving around. Just sit.
Okay. Just help me to understand a bit more. Is there any particular period where the teacher complained that he talked excessively when other people is talking as well?
Yeah. He doesn't wait his turn. He wants to talk. He doesn't understand how to talk and when to talk.
Okay. Just wonder, did he have any difficulty to pay attention as well in the school and at home?
Yes, he's not paying attention when the teacher says anything. He is easily distracted.
Well, how about at home? Do you find it difficult? Do you find it him difficult to pay attention, difficult to finish the
Yeah,
task?
yes, exactly. Whenever there is homework, he doesn't.
Right.
He's not able to continue the homework. Yes.
Right. So you are saying that he's easily distractible, is that right?
Yeah. Yes.
Right. Do you realize that he always misplaces his item, always
Yeah,
loses his
exactly. He
things?
always forgets things and misplaces things. Always.
Okay. Okay. Is he able to organize his schedules, pack his
No,
stuff?
no, he's just 5 years old, but just
Right.
he's not like his other children, other
Uh,
siblings.
right. You mentioned that he was a bit different from other siblings. Can you realize
They are
that
not
he was a
active
bit
like him. They did not, they are a bit, they are more disciplined.
right?
They seems to be obeying whenever I instruct them with anything. They are okay with it.
Okay. Okay. So do you realize that he always fidgeting when you bring him to the
Yes,
shopping center?
exactly. Yeah, 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 yeah.
Does he blurt out the answer before even teacher finish questioning?
Yes, yes, yes.
Okay. I just wonder, with all this, did he do something very impulsive, like for example, out of the spur of the moment?
Yes, always he just does things suddenly. Yes, exactly.
Could you tell me an example of that? What did he do?
Suddenly he can run while we are walking in the street just to follow a butterfly or to run after a cat. And we feel sometimes that this is risky. We hold him, there is a particular toy with a strip to make sure that he is not, we hold him, not allow him to run rapidly anywhere.
Right, right. Did he get physically hurt because of his act?
No, he doesn't physically hurt. He always have some injuries because that he is clumsy. He plays in a
Okay,
particular way, which is he's very playful, but he always have some minor injuries, not major injuries.
I see. Okay, thank you for sharing with me, Mrs. White. I just want to ask a few questions. I just wonder when you are pregnant, is there any problem with your pregnancy?
No, no, there is no problems in the.
Okay. Is this his first time seeing a psychiatrist?
Yes, first time for him to talk with psychiatrist or me even.
Any family members involved in the mental health service?
Yes, no. Well, he has one of his cousins with a similar problem. 1 minute remaining.
Right. Um, I just wonder, with all this ongoing, do you notice that he has some unusual body movement or repetitive
No,
body movement?
no, no,
Right.
no.
Is he generally cheerful?
Yeah, 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 yeah.
Did he get involved with stealing or setting a fire?
No, no,
Did he
no.
get involved
It's
with that?
only 5 years old. Cannot do these
Right.
things.
How was his school performance?
School performance just only 5 years old.
Right. Did he cope well with his studies?
No, no, actually.
I see. Mrs. White, thank you for sharing with me. It seems to me that you have concern about his behavior being hyperactive, having difficulty to sustain attention, and also doing something impulsive at times. So actually, I would like to talk to the school to get more information, and we will get back to you. Is that okay?
No, not okay. Why didn't you say that most probably he's suffering from something called ADHD, which means that he has a problem with attention and activity and impulsivity? Why didn't
Oh,
you say
okay.
this? Most probably, but we need to confirm this. So we need to just, you must say the diagnosis at the end of the station. It doesn't sound right that you gather all this information and at the end you don't come up with anything.
Okay.
It doesn't
Okay.
sound right, isn't it?
Okay. Sure.
So you
Sure.
gather all the information in order to come up with a diagnosis because, as I told
Okay.
you, taking history is a constructed approach, okay? In order to, at the
Okay.
end, you come up with a provisional diagnosis. If you are not sure,
Mm,
you can say most probably is suffering from
mm,
so on. So we need to do our work to make sure of the diagnosis, okay?
okay.
Okay, let's see the feedback of our colleagues. Okay. I find that you're repeating the questions now. Please pay attention because uh,
Okay.
how is he doing with the studies? He asked me this question another way. if he is doing his homework well, and how is he doing it. So as I told you, he doesn't do his studies, he doesn't do his homework. So you kept repeating the questions. You spend a
Okay.
lot of time gathering information about the nosology. As I said, there are many things important in the history-taking task other than the nosology. And unfortunately, this is a common mistake, that they can just focus on the nosology and they think that this is the history-taking task. There are many things, as you can see in the mark sheet, which you should cover other than the symptomatology. So let's see the, give her some feedback, doctor. They don't want to give you any feedback. No. Give her some feedback. Okay, so let's see the our notes. Okay, so you introduced yourself in a very good way, and you showed empathy when we started to talk about the problem of my child. The first thing, you tell me more about his behavior and at home and the school. Does he want to know the current situation? You must take the complaint, the current situation, his behavior at home and school. Since when is it increasing or decreasing? And before the onset, how was he doing before the onset or before that? This question is very important to show that it's not only when it did not start with the school. He has been doing this all over his life. So this is the predisposing factors or whatever you should ask. So you want to show the examiner that you picked up that this problem is going on not only when he started to go to the school, it has been going on all over his life. Then the symptoms of the syndrome, we know that ADHD is a problem of attention, impulsivity, and activity. And you must establish that these problems are in at least in 2 settings, at school and okay. So, and then very important to ask, how does he play? When you ask about the developmental problems in the autism or ADHD, very important to ask about the play and the behavior. It is part of the assessment. How does he play? The ADHD have a particular way of playing. They are very cheerful, they are very sociable, and but they don't focus on one game. They just jump from one toy to another. Okay. And they are play in a very clumsy way. They usually have scratches all over their body because of the way they are playing, in contrast to the autism. And the behavior, whether he's sensitive to changes or repeated behavior, just to make sure that he doesn't have any autistic features. So very important when you assess the symptoms of syndrome that you make sure that you ask about the play and the behavior. And then very important, you ask about the developmental. Did you ask me about the developmental history of the baby? You did not ask.
I think I did not.
Very
I missed
important.
that out.
I don't think you will pass the station if you don't ask about the developmental history. So it's
Okay.
very important to ask about the play, behavior, and developmental history in the ADHD and the autism. And then the comorbidity, very important also to ask the comorbidity. Particularly not the psychological, but the physical. If he has seizures, okay, or physical problems. And very important to ask about the social comorbidity, because mostly the family is find it very difficult to control this child. I had this station and I passed it, and actually I remember the feedback from the Oxford mock, particularly when I asked the mother how does she cope in taking care of this child with all the problems she is making. So the feedback of the examiner was good, in particular because I paid attention to the social part of the child. Okay, so the comorbidity is important, particularly the physical and the social. As I always say, make sure that you have good time management. When you hear the bell of 6 minutes, ask about the impact, coping, and the risk, past history, family history, and finally deliver the diagnosis. You can hardly finish these 3 points in 1 minute. Okay?
Okay.
Past history and family history, not uncommon to have a family member with a similar diagnosis. And finally, delivering the diagnosis. If you just say from our discussion, seems that your child is having something called attention deficit hyperactivity disorder, I will give you leaflets about it. And if you have time, just give her some information. It is a developmental disorder, more common among boys. It causes problem in attention and hyperactivity, and also a problem in the impulsivity. That's it. I don't know what did you do at the end, but I did not hear the diagnosis. Okay, so let's see. Very important, doctor. I'm repeatedly showing you this mark sheet in order to understand how are you scored and to know what you should do in this station. Maybe you feel that you are performing well, or your colleague says to you that you're performing well, but in fact, it's about this mark sheet. If you don't score enough in it, whether you feel that you performed well or your colleagues give you a good feedback, if you don't score enough in this worksheet, you will not pass. So you did identify the issues and priorities, the significance aspects of history, you did pay attention to it. You did explore in depth, actually. This consumed a lot of time. So 3 points would be scored for you. Demonstrate adequate skills and risk assessment. Did you ask me about any risk or anything to? Did you ask? So 0.4 would be scored for you. Social and psychological, I don't think that you covered this. Health review, if you ask me how are you coping with this, definitely this will be scored for you. So from the history taking points, you will be scored only 3 points. Because you did not give me the final diagnosis, most probably this will be considered poor management of the consultation. So 0.7 will not be scored for you. It was not formality or communication skills were good. Your questioning skill could have been better. Other than this, everything is good. Okay, again, this is not a pass or fail, but just to show you the importance of using this mark sheet whenever you are practicing, okay? Don't just practice without making sure that your performance will help you to pass. Thank you so much, Doctor. Very clever. Okay.
Okay. Thank you.
So much. Who would like to go next?
I can go next.
Okay, sorry.
You just make sure that which one. Okay, Dr. Kubra. How are you, Dr. Kubra? So what is your station, doctor?
It's GHB dependent.
GHB dependence. As you can see, a lot of substance misuse dependence. Okay.
It's not showing up.
You don't see it?
No.
Okay, wait. Let's stop.
Okay.
Ready? Okay.
Yes.
So let's see. 1, 2, 3. Okay, can start.
Hello, I'm Dr. Kubra from the Mental Health Unit. How may I address you?
You can call me Michael.
Hello, Michael. I understand from the notes that there was some incident recently and you were admitted in the hospital. Can I know about it?
Well, I don't understand what happened. I just the last thing which I remember that I was in a party, and then
Okay.
everything. I don't remember anything else.
Okay, so there was an episode of collapse. Can you remember what happened just before you collapsed?
I was in a party. We were having fun, and I took something. I took half a bottle of alcohol, and I took GHB, and this is the last thing which I remember.
Okay, so thank you for sharing with me this. So you took GHB. May I know how much amount did you take?
Well, I took about maybe 5 cc. This is not. This is more than the amount which I used to take.
Okay. And do you remember who took you to the hospital?
No, no, no.
And do you remember after how much time did you gain the consciousness?
No, no, I don't remember anything actually.
Okay. So you initially you took the GHB. I'm quite concerned. Is there any history of any physical illness,
No,
Mr. Mike?
no, no.
Okay, so talking about GHB, I need to ask some sensitive questions because I need to explore more so that we can help you in a better way. Can I
Okay,
ask,
okay.
since how long have you been taking GHB?
For about 5 years.
5 years. And do you remember what was the reason? Why did you take the GHB?
You know, I beg your pardon. We used to take it. Whenever we go dating, it helps, make things easier with the girls. That's it. So I started taking it like this.
Okay, okay. So, can there be any reason that there was any life stress, that's why you took GHB?
No, 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 no.
Okay, and may I ask you what was the dose of GHB that you used to take?
Well, I did not used to take the current dose. I used to take maybe just once a C, once every week, once every
Okay,
time I go dating. Now I'm taking it on daily basis.
okay. So what I understand is that initially you used to take the GHB occasionally, but with time you had to increase the dose.
Yeah.
And may I know the reason why did you increase the dose?
Well, with time, it doesn't make the same effect, so I need to increase
Okay,
the dose.
yes. And how do you take the GHB? What is the route?
I just drink it, but lately I started to inject.
Yes. And is there any history of needle sharing, Mr. Michael?
Excuse me?
Is there any history of needle sharing
No, no, no,
or any history of sharing of syringe?
no, no.
Okay. And have you ever been not using GHB for a day or for some time?
Yeah, yeah, I tried to stop, but I feel horrible when I never stop this.
Okay. And what are the symptoms that you feel after not taking GHB? May I
Well,
ask?
I feel horrible all over my body.
Okay. So you get this feeling of restlessness,
Yeah, yeah, yeah.
sweating.
Yes.
Okay. And you just told me that you tried to stop the GHB. For how long did you try to stop the GHB?
Well, I tried several times to stop 1 or 2 days, but I cannot tolerate the symptoms, so I tried to.
Okay.
I return back.
And what was the reason of returning back to GHB?
I cannot tolerate the symptoms.
Okay, I can understand there's lots of things are going at your end, but I'm also worried about the other things. Mr. Michael, how has your mood been all this time?
My mood is not good. I try to just to calm myself with this. I feel so bad that I'm indulged in it.
Okay, I'm so sorry to hear that. And what about your sleep, Mr. Michael?
Well, I sleep only if I take GHB. It helps me to sleep.
Okay. And do you enjoy things that you used to enjoy before?
Um, well, I enjoy everything. I cannot say that I don't enjoy life, but I don't
Okay.
like my life with this thing going on.
Okay, so you are saying that you don't like your life. So when the people are under this stress, they usually get these things of ending it all. Is that the case with you,
No,
Mr.
no,
Michael?
I just hope that I stop taking drugs. Stop taking
Okay,
GHB. 1 minute remaining.
okay, I understand. And what about how has the GSP impacted your work?
I don't work, doctor. I don't have any job now. Always leave any job I work in.
And I was wondering, how do you arrange your money for GSP?
I do some drug dealing, not too much. That's it.
And is there any history of encounter with the police?
Yeah. But no charges.
Okay, and have you ever done dangerous driving under the influence of GHB?
Excuse me?
Dangerous driving under the influence of GHB.
No.
Okay, so thank you so much, Mr. Michael, for talking to me. What I understand is that you are having the problem with GHB, and this usually we call as GHB dependence. And I will engage you with the substance and
No.
alcohol.
I'm not interested in this.
Okay, so you are not motivated to get indulged into the services.
Fine. How do you feel about what you did? Give me feedback. Okay, give me your feedback. By the way, it was good. Give her some feedback, doctors. Yes, she repeated some questions. The birth history. What is birth history? No, this is maybe improving some of this. Okay. No, they did not give you. They are giving the feedback to someone else. Okay, so how do you feel about what? Give me your feedback about what you did.
I think in history part, I did not cover all of the things, independence, like craving, control,
Yeah.
and history of other use of other substances.
Okay, continue.
And
Please.
maybe at the time at the time of collapse, I should have also asked about whether there was any history of intake of sedatives. You took
Yeah.
alcohol, you took GHB, maybe any history of.
Okay, so we'll see. So, very good. The first thing, this is a man who just came up from coma, show empathy. Well, the medical team is worried about you being through a coma and they want me to talk with you. Are you okay with that? Show empathy, okay, in the beginning of this station. Someone who just woke up from an overdose, definitely he needs some sort of empathy. And actually, in this station, he will complain that he still has some shakiness in his hands and is not feeling well enough, but he can continue talking with you. And always say that you know that this is a sensitive issue and you need to take permission. For how long and what is the reasons to stop? I don't know. You asked some questions which are not related to the dependency symptoms. For how long? I don't know some. I feel that just you must look. If you paid attention to the stations of alcohol dependence, GHB dependence, and the heroin and the opioid dependence, they all have the same set of questions. I felt that your questions to ask about the dependency syndrome are not that good. So you make sure that you ask them in a better way. I beg your pardon, in this particular station, when you ask about the risk, there is a particular risk which is related to the GHB, which is the chemsex. Ask him if he is involved in this chemsex, which is unhealthy sexual practices. And at the end, don't be motivated, don't be judgmental. You are not motivated. We don't do this. We don't say that you are not motivated. We said that we use some of our consultation skills which are used in the motivation interviewing techniques. If he says to you, no, I'm not interested in involvement or talking with any of the substance misuse services, so you develop discrepancy. So you mentioned a lot of problems because of GHB intake, but at the same time, you are not keen to seek help. Where does this leave you? We don't say to him, you are not motivated, shut up. No, this is not the best way to respond to someone who is not motivated to take our service. Okay. So see the okay, so the first thing when you introduce yourself, just show empathy. The medical team is worried about you, and I'm asking you to discuss with you about what has happened. Okay. Okay. Check how he's doing after the coma. If he, because he will say that he still has tremors and sweaty and palpitations. Then take the ABC details of the incidents. Okay. What happened before the incidents, what happened during the incidents, or what happened after the incidents. Okay, so let's see how we can do this. So ask him about the coma. How are you doing now? Any complaints? Do you know why did you come to the hospital? What is the last thing which you remember? And ask him about the details of the incidents. What did you take before losing consciousness? How much? How did you take it? Did you take anything else? In this station, he took alcohol. And what was in your mind when you did this? Did he take it to have a nice time, or he wanted to end his life? He's supposed not to know what is going on in the station, so you must ask him what was in his mind. And then after the incident, do you remember anything? Do you remember how did you come to the hospital? And before the incidents, I'm wondering, is it the first time to have medical problems because of GHB or overdose, any stressors? How were you feeling before the incident? So you want to know before the incidents, how was his life going on, and if he has ever had any medical problems or complications because of the GHB. So this is the ABC of the incidents. If he came to you with a coma because of GHB, you want to follow the ABC. And then the GHB dependence. Okay, take permission before asking or taking details of the GHB intake. You know that talking about GHB is a sensitive issue, but in order to help you, I would like to ask some questions related to it. Are you okay with that? Want to know the current intake, the onset, the course, and before the onset. So very important to show that you know how to ask about the complaint. You want to know the current situation. Since when did you start taking GHB? How did you start taking it? By drinking or injection? Since when are you taking the current dose? Anything happened at this time? And then the course to demonstrate the tolerance. And you want to know before taking the GHB whether he has been indulged in taking any other substance. Very important to ask these questions, which will help that you understand how to start taking the history, which is you start by taking the complaint. And then after talking with him about GHB, now you feel that this man might have a GHB dependence. Ask him about the dependence criteria, the tolerance, the withdrawal, the craving, control, and primacy. Okay. And then very important to ask about the comorbidity, particularly the social. Okay. And by the way, if you don't have any idea about the GHB is very common to very close to alcohol problem, but it is a more GABA agonist than alcohol. So whenever there is withdrawal, it is more severe. So the patient gets severe agitation, tremors, sweating, and it is very common to have paranoia and hallucinations during the withdrawal. Okay, if anyone is not acquainted with what is GHB, just think of it as if it is a strong type of alcohol. Okay, very important, as I said, to ask about the comorbidity and the impact and coping and risk. As I said, whenever you hear the bell of 6 minutes, immediately ask about the impact and coping and risk, particularly chem-6. Okay, the risk here is very important. Personal history and family history, very important also, because not uncommon to have another family member with the same problem, or whatever the problem of dependence is. So it can be a GHB or alcohol, period. And finally, delivering the diagnosis, show empathy. As I said, don't say to him that you're alcohol dependent. Just make it smooth. From our discussion, it seems that you have a lot of problems because of GHB and you find it difficult to stop. How do you feel about something which we call GHB dependence? So I did not write it here because previously they said that you should not say it. Now the consultants say that you should say that you should have alcohol dependence. It's something which we GHB. Okay. How do you feel about talking with one of our team members who can help you to sort out these problems and to stop taking GHB? If he says no, and actually in this station he will say no, the role player is instructed to say no in order to challenge your consultation skills. And as I said, when he does this, do this motivational interviewing technique. Okay, thank you so much. I hope that you found it helpful, Dr. Kubra. Well done. Have you ever been to the CASC before?
No, Dr. Khan.
Okay, very good for the first time. Very good, excellent, very good.
Thank you.
So who would like to go next?
Can I go with OCD?
Yes, of course. So what is it? Yes, Dr. Sayed. What is your station though?
OCD.
Okay.
Okay, how can I call you?
You can address me, Michael, no problem.
She's a woman?
No, it is the way height. So you can, miss, you can call me Mrs. Brown. Mrs.
Brown.
Brown. Okay, let's start. 1, 2, 3, go.
Hello, Mrs. Brown. I'm Dr.
Hello.
Abdullah. I'm Dr. Abdullah, psychiatrist from Mental Health Unit.
Yeah.
Okay. I have gathered from the notes that your GP was concerned about you and referred you to talk to one of our team.
Yes, doctor. I know that it is a very absurd thing, but I cannot hold. I can't control. I keep washing my hand, and I don't know, doctor. And I feel that everything is contaminated. Even all the items of my son are contaminated because of this corona issue, and I must keep sanitizing everything around me.
Oh, it must have been a very difficult time for you, Mrs. Brown. Okay, but I want first to ask you some questions to know more about this issue. Okay?
Okay, no problem.
Okay. When did you start to have this problem?
Well, it started about 9 months ago.
9 months ago. Okay.
Yeah.
During this 9 months, does this problem increase? Did this problem increase with time?
Yeah, I feel with time that everything around me is contaminated. I must keep washing everything.
Okay. Is there anything increases or decreases the time you wash your hands?
Well, temporarily, doctor, I feel temporarily that that everything is okay after washing my hand, but now, but for just few minutes, I feel that I need to wash my hands again.
Okay, so you have a sort of washing your hands, then you wash your hand, and
Okay.
the salt decrease. Is that right?
Yes,
Okay. Before the 9 months, how are you doing?
everything is okay.
Everything was okay. Okay. Was there any stressors then?
Yes, I gave birth to my son 9 months ago. This is the only thing which happened.
Uh-huh. Okay. First, congratulations on the delivery. What is the name of your son?
Michael.
Michael. Okay. Congratulations, Mr. Brawan. Okay. Was there any medication before the 9 months? Was there any medication?
No.
Okay. Okay, Mrs. Brown.
What do you mean
Okay.
by any medication? I used to take sertraline, but I stopped taking it to be pregnant.
Okay. Why was you taking sertraline?
I was diagnosed with obsessive compulsive disorder.
Obsessive compulsive disorder. Okay. Can you tell me more about that?
I've been diagnosed with compulsive 5 years ago, but I started taking sertraline and everything is okay. It was okay for about 3 years, and the doctor said I can stop it to be pregnant.
Okay. So you stopped the medication when you was pregnant. Okay. Okay. We will back to this later on. Okay.
Okay.
Okay, Mrs. Brown. I want to ask you some questions about the nature of these thoughts. Okay.
Okay.
Okay. About these thoughts, is this thoughts do you find these thoughts distressing to you?
Yes.
Okay. Do you try to resist it?
Yes.
Okay. Does this thought make any sense to you?
No, it's totally absurd.
Okay. Do you feel that this thought is intrusive?
Yes, keep intrusive. Yes, keeps coming. Yeah.
Okay, I want to ask you about if there any other thoughts with the same nature.
Okay.
Okay. Like I think like any religious thoughts of some
No.
Okay. Any interesting images?
No.
Okay. Any thoughts about contamination or infection?
No.
That's it. Okay. When do you have these thoughts? What do you do?
Oh, I keep washing my hands 5 times at least, and one of them at least with alcohol.
5 times with alcohol. Okay.
Yeah.
And after you wash your hands.
I feel just temporarily relieved. That's it.
Okay, temporarily. Okay. Other than washing, any other rituals decrease in anxiety?
No.
I think like counting or
No.
ordering things in a. Okay.
No.
Okay. Any other rituals?
You just asked me. No, I don't have.
Okay. I know this is a difficult time for you, Ms. Birwan. My thoughts is with you. Okay,
Yeah.
Mrs. Birwan. I want to ask you a few more questions to address other issues. Okay?
Yes, okay.
Okay. About your mood, how was your mood in the
My
last
mood is
2
fine, but you know, I'm frustrated because I feel that what I'm doing is out of control.
hours? Okay. And about your sleep?
Good.
Okay. Do you eat well?
Yes.
Okay. Do you
1
still
minute
enjoy?
remaining.
Okay. Okay. During this period of stress, maybe there may be some strange thoughts. Do you have any strange thoughts?
No,
Like people following you or trying to harm you?
no.
Okay. By any way, do you have any voices? Do you hear any voices when
No,
nobody around?
no.
Okay. How this impacted your life, affected your life?
I cannot do anything. I'm totally involved and drained in this issue.
Okay. And how this affected your son?
I'm not able to take care of him, and actually I feel that I need also to sanitize him. I'm very worried about from this.
Okay. Okay. How you cope with all of this?
I don't know what to do, doctor. The only thing is washing my hands.
Okay. Do you drink alcohol
No,
or any recreational drugs?
no.
Okay. You told me earlier that you have diagnosed with OCD 5 years ago. Okay. Any other member of your family have any psychiatric issue?
Time.
Okay.
You are doing fine, but the thing that you have a lot of pauses, and every sentence you waste time because you add, well, maybe 2 words or 3 words which are not necessary. This sums up not less than 20 seconds or 30 seconds at the end of the station, wasted because of these too many pauses and because of your long sentence. For example, you wanted to ask me about the family history. So you started by saying, you mentioned that you have OCD. What about your family members? You just ask me, well, any one of your family members had similar problem being diagnosed with. Also, just ask me directly. Why did you stop this by asking me about my past history again? Come up with a question about the family history. Okay, but it was very good, by the way. Very, very good, actually. I like it, actually. I like it. Just make sure that you have better time control. You ask about, and just my only feedback is that when you ask about the anxiety, in this station, make sure that you ask about anxiety as one of the comorbidities, because we know that OCD is an anxiety disorder. Okay, good that you ask about the risk for the child.
I was planning to ask about the anxiety, but I just had to jump because time.
Yes, exactly. Okay, so let's see the feedback of our colleagues. Fair attempt, neurosis is a medical jargon. Yeah. Well, I did not pay attention that he said neurosis.
I didn't say neurosis.
I don't know. He said, well, I did not hear. As I said to you, even our colleague says that you also use very long sentences. It sounds, well, suppose that you will say about 30 sentences in the station. If you add 1 second in every sentence, this sums up 30 seconds at the end of the station. Don't underestimate that this unnecessary elongation of the sentences. It will affect at the end of the station the time limit. Okay, let's see the feedback of well done. Okay, so let's see. Okay, so let's see. Now, in this particular station, I remember they asked in particular, ask the role player, or in particular, to show to pick up the obsessions, because the candidates passing rate in this station was very low, because they don't know how to ask about the obsessions to differentiate them from other patterns of morbid ways of thinking. But cleverly, Dr. Sayed picked up this and he asked about the obsession, and this is a very good start. And definitely, if he just showed that he is able to ask about the obsession and he knows how to differentiate between obsessions and the other types of abnormal patterns of thinking, this is enough for him, from my perspective, because the passing rate in this station is very low because the candidates don't know how to ask about this particular issue. So I hope that you all have pens, and let's see how to ask about this type of abnormal patterns of thinking. Okay, so as I always say, the history-taking task is a constructed task. You start by taking the complaint. You want to know the current situation, the onset, the course, and before the onset, and very cleverly, he picked up that there has been a predisposing factor. This lady was pregnant, she did delivery, and she has a history of OCD before. So very cleverly, he picked it up because he took the complaint in the right way. We know that no one wakes up in the morning with a psychiatric disorder. There must be a predisposing factor or a precipitating factor. So in this station, the precipitating factor is delivery, and she has a predisposing factor, which is a past history of OCD. Okay. Okay, so how to ask about the symptoms, or just to show the examiner that we are able to crystallize the issue of obsession. We know how to assess the obsession. So we have the acronym, which is DROSI, DROSI, stands for distressing thoughts, trying to resist these thoughts, own thoughts, and sense, does it make sense, and intrusive. These 5 questions are enough to show to the examiner that you're able to know whether this thought is an obsession or not. And then we also must show the examiner that we know that the patients who have OCD also might very common to have other obsessions and other compulsions. So the most common obsessions here, other than the contamination, infection, intrusive images, guilt, aggression, religious obsessions, all these obsessions, you can have the acronym of SIGAR to make sure that you'll cover them accurately. And then the compulsions, common compulsions, we have the checking and the rituals, the ordering and the wash, and we have the acronym of CROW. So we have SIGAR, CROW, and DROSI. If you start the station by this, definitely you will give a very good impression about yourself to the examiner. That you know how to ask about the obsessions, you know what are the common obsessions, and you know what are the common compulsions. Now, regarding the comorbidity, the only thing which the mistake which he did not ask about the comorbid anxiety disorders, because this is primarily a anxiety problem. Okay. Please, doctor, don't forget to ask about the social part or social problems, because not because you will see in the mark sheet that there is a point about the social information, whether you check about it. So you want to know how the patient's life is going on, if she's having his stressors and so on. Okay. And actually, if you ask about the impact, definitely this will cover the social, but make sure that this will be covered. The impact, coping, and risk, and very cleverly, Dr. Said pay attention that there is another part or another person in this issue, dependent on the patient, and you need to check the risk on him, which is the baby. Very clever, doctor. Unfortunately, he did not show good time management enough to, as I said, unfortunately, he did not deliver the diagnosis, and he wasted time in asking about the past family history and so on. So let's see the mark sheet. Again, it's all about the mark sheet. So definitely you identified issues and priorities. The significance of aspects of history was good. Does not visit everything in the history taking was good. Everything was good. But regarding the communication, it was not very organized. So most probably you will lose point number 7. Not organized because we were not able to come up at the end with the diagnosis. It was not formalic. Your attitude was good, your listening skill was good, but unfortunately you lose point number 7, 11, and 12, which are related to the language and your questioning style. So point 7, 11, and 12 might not be scored for you, but everything was good in your performance, very clear. With time and practice, definitely you will come up over these issues. Thank you so much, Dr. Said, very clear. Who would like to go next?
I can go next.
So what is your station, doctor?
Grief reaction.
What?
Grief reaction.
Grief, yeah.
I'm ready.
Okay.
What is the name of fish?
Let's say that my name is Mrs. White. Very clever. Okay.
Mrs.
Mrs. White.
Okay.
Okay, let's start. 1, 2, 3, go.
Hello, Mrs. Y. My name is Dr. Bijal. I'm one of the psychiatrists from Mental Health Unit.
Hello, doctor.
I have gathered from my notes that your GP is quite worried about you. Is it okay with you if I go to say?
Yeah, no problem.
I'm sorry to learn about your passage of your husband, and I can see it quite a difficult time for you. But in order to help you, I would like to ask some questions. Would it be all
Okay.
right to you?
Okay, no problem.
Could you tell me a bit more about the passage of your husband? What has happened to him?
Well, it happened about 6 months ago. He died in a car accident. I asked him to bring some medicines, and it was late at night, and he died in a car accident.
Okay, I can see it is quite distressful to you. Could you tell me, were you with him?
No, I was alone. He was alone.
Okay. And did you able to manage his weight?
Excuse me?
Did you able to manage his weight, his burial?
I don't know. I feel that life has changed dramatically, doctor. I don't know if I'm able to cope.
And have you been able to his grave place since then?
Are you able to do what?
Able to, frequently went to his grave place?
Yes, I go to his grave, yeah.
Mhm. And could I check with you, how was your relationship with your husband?
Well, it was a very good relation. My life was all about him.
Okay. And sometimes people who lost some loved one, they feel some different experiences. Can I check with you that have you ever been
Okay.
felt angry about this?
Yes, I felt sometimes angry because we were so good and very religious and pious, and I don't think that this should have happened to us.
And do you feel that you were not able to believe the news that your husband is no more?
Yeah. In the beginning, I felt that it is just a dream, and this is some sort of practical joke. Until now, I'm not able to believe that this has happened.
And have there been time in which you started to bargain the things? I mean, you felt that you should be there instead of your husband.
Yeah, sometimes I ask God if I only did not ask him to go at night to bring the medicines, maybe he wouldn't have died. If I just can donate my money, this will bring him back.
And do you feel that you are now accepting the things that your husband is normal?
I feel that I'm able. Yeah, yeah. I'm trying. I'm trying.
Mhm. And through all this going on, how has your mood been?
Well, my mood is not that good. I feel that I'm not good. Definitely, I'm not feeling happy.
It seems to me that it must have been difficult time for you. Could you tell me how has your sleep been?
Well, I keep crying at night and that's it. Just until I sleep.
Mm. How has your appetite been?
I lost about 10 kilograms in the past 6 months.
Mm. Okay. And are you able to enjoy things that you used to enjoy previously?
No, no, no.
Mhm. And people usually, who lost some loved one, they can hear voices of their loved one. Is this true with you?
No, no, no,
Are you able to see your husband?
no, no,
Mhm. Okay. Okay. And do you have any thoughts of harming yourself?
no, no, no.
Mm. And how would you see your future?
I don't know, doctor. I don't feel that I'm able to have a future without him. It is difficult.
Mhm. And how are you coping with this? Do you use any alcohol or some
I
recreational
don't know
drugs?
what to do. I don't know what to do.
I can say you are quite distressed, and but in order to help you, I need to ask a bit more question. Would it be all right to you?
Okay, no problem.
Yeah. Do you use any alcohol or some recreational drugs?
What?
Do you use any alcohol or some recreational drugs?
No, no,
Okay. Can I check with you? Is there anyone around you to support you?
no, no one around me. 1 minute remaining.
Uh, how this has impacted on your life?
Well, my life is totally different. I don't know what to do. Everything I used to do with him, now I'm not able to do anything. Like I don't know what to do.
I can say you are in quite, difficult experiences, and I would like to see you again to see how best we can help you.
Okay. Okay, so still you have
Can go
20,
on.
you finished?
Yes,
Okay. Give me your feedback.
I think bit more checklist type.
Well,
Uh,
one of our colleagues saying the termination should have been more clear, say that you are passing through the grief
yes,
reaction. There is
great
many things by
reaction.
which we can help you. And in addition, I think you felt that I also have depression. Okay, so you can say that this would be also associated depression, which is not uncommon. So this station, it can come with depression or without depression. But if you find that the patient is having depressive symptoms, you must say it at the end of the station. Didn't you feel that I'm depressed? I gave you all the symptoms of depression.
Yes.
And then did you ask me about the mummification? Mummification. Very important, the abnormal grief reaction, which is the mummification. And the past history, you did not ask me about the past history, if you have ever been in contact with psychotic services. Okay, so let's see the grief reaction. Okay, in this particular station, doctor, it is not that difficult, but this particular station, there is a big and a considerable magnitude on communication skills in this station. You must show empathy in your tone and several times show to her that you understand what she is passing through, and definitely you'll help and just show empathy. All cover this station with empathy. The patient, the candidates do not pass this station because they don't pay attention that this station has a magnitude of communication skills in it. It should not be neglected. Okay. And then in this station, if she starts now, pay attention to the complaint. So this the GP has referred her to you because she might be depressed. Okay. So in the start, you must ask her that the GP is worried about you. He feels that you might be depressed because of the difficult time which you're passing through, and ask her about the depression in the beginning. So they want to know the current situation. So if she starts talking about the low mood, ask her about the depression. If she starts talking about her unfortunate loss, talk about the grief. Okay, but let her talk. So I would like to know more about what you are experiencing now. Let her talk. If she talks about the low mood, we will go through the symptoms of the depression, rate your mood from 1 to 10. Anything, guilt feelings or sense of worthlessness. Okay, very important to ask this question. The anhedonia, how does she feel about the future, and so on, and the unusual experiences. And you want to know more about this depression. When did it start? Is it increasing with time, which is the onset, course, and duration? And before the onset, how were your life before this unfortunate loss? Okay, so this is how you start the station and ask about the depression. And then ask about the symptoms of the syndrome, which is the grief, reaction. We know that, and just ask her, so such painful loss can bring different emotional experiences, which I would like to check. So this is how you start talking about the different items or different symptomatology of the grief. So you ask about the denial, and the mummification is considered to be a form of a morbid denial. Okay, so if she is still keeping his belongings, and so this is a state of denial. She's not accepting the fact that he is dead. So if she is keeping his belonging, and she is acting as if he is still alive, like preparing his food and washing his clothes, so this is a morbid condition, morbid state of denial. So you should put this mummification symptom with while you are checking the denial. And then the anger, the bargaining. Unfortunately, the candidates do not know how to ask about the bargaining. So as if she says that, what if, for example, the story goes that this lady asked her husband to go in the middle of the night to bring for her some medication. So a bargain, so what if I did not ask him to go to bring the medications? Or if I only had to wait to the morning, or if I do this, then this will happen. All these are sources of bargaining, or bargaining with a higher power, like donating all of her money in order to bring her husband back. So this is the form of bargaining, and you must give 1 or 2 examples to show to the examiner that you understand what is bargaining. Okay, depression. You also if you did not assess the depression in the beginning, you should ask about the depression, and then ask about the acceptance. The comorbidity, very important to ask about the social comorbidity, if there is anyone around her to support her. And then the impact, coping, and risk, past history, families. Everything is okay in this station, except it's not that difficult. But the problem is with the communication skills. Okay, and at the end, if the patient has depression, you must say it. and you must show empathy when you are saying the diagnosis that she is passing through a grief reaction, and she might have depression or not have depression according to your assessment. I was just for time management. Just I will not go through again through this mark sheet. I already went through it several times. But all in all, I think you understand where all mistakes, Dr. Bijam. Very clear. Who would like to go next? Are we finished? Okay. Well, it was a pleasure and a privilege, to see all your names in the post list. Okay, thank you so much, doctors. Have a good night.